Hi everyone, I'm drkerryann Williams. Welcome back to Black Mental Health Matters. On today's show, I'm going to be speaking with Dr. Kevin Simon. Dr. Simon is a specialist in child and adolescent psychiatry as well as addictions medicine. So today he's going to be talking to us today about adolescent substance use. So if you're interested in hearing more about substance use in teenagers, then keep listening.
Hello, everyone, and welcome back to Black Mental Health Matters. I'm drkerryann Williams, a psychiatrist practicing here in Massachusetts, and this is a talk show about everything related to mental wellness in the Black community. So if you want to call in at any time, the phone number here is 617-238-7111, and we're also streaming live on Facebook. Just go to the page heat981fm.com on Facebook. You'll see the live stream. I've also shared it to my Facebook page, so you can watch a live stream on Dr. Kerryann. So, guys, today, welcome. I have with me Dr. Kevin Simon. Dr. Kevin Simon is a Harvard-trained board-certified psychiatrist. He completed concurrent fellowships in child and adolescent psychiatry and addictions medicine at Boston Children's Hospital, Harvard Medical School. He is also a Commonwealth Fund Fellow in Health Policy at Harvard University. He has received numerous awards in recognition of leadership and service, including the Arnold P. Gold Foundation Humanism and Medicine Award. He has written extensively. His writings on inequity, social determinants, and substance use are published in notable journals, including the New England Journal of Medicine, and he is regularly sought after for consultation with Fortune 500 companies. He's been featured on ABC News, Forbes, and NPR. So I feel really honored to have him here with me today. Welcome to the show, Dr. Simon.
Hey, Carrie-Ann. It's a pleasure to be here. Dr. Williams, how are you?
Doing well, doing well. So tell us a little bit about, how did you even decide to specialize in child and adolescent psychiatry and addictions medicine? Like what drives you?
Yeah, so I guess this would go back to days in medical school where, when we get to third and fourth year, we kind of rotate through all the core specialties, and psychiatry was the one that I think most spoke to me because it intertwines social dynamics, medicine or core medical issues, and then stories. And so having those three interests throughout my life, psychiatry tended to be the one or the field that best tied all those together. And then I think specifically to child, when you actually think about a lot of the psychiatric conditions that we treat, anxiety, depression, psychosis, substance use disorder, bipolar, most of them actually have their genesis in the adolescent age range. So you're talking about 16, 17, 18, and sometimes even younger. So for me, it felt like in order to kind of be a well-rounded, holistic psychiatrist, that I needed to do child psychiatry. And then when I got into child psychiatry, what I came to find out was there are, massive, huge gaps and disparities there. And one of them that particularly interested me was addiction and how substance use and addiction plays out in Black communities, both from, the actual condition that happens to the particular patient or person, but then how that manifests within the family dynamic. And then that ties in things like school, justice systems or juvenile justice systems. So again, a lot of my varied interests lended themselves to then want to do training concurrently with addiction medicine. So that's kind of how I tie all those things together. And so basically my core patient that I see and that I kind of often think about is in essence a young Black or brown male or female who, for no fault of their own, is struggling with some mental health condition, and then somehow, some way gets tied into engaging in substance use, and that then further leads them potentially into things like juvenile justice system. So that's kind of how my interests tie together clinically.
Wow, I think about that because I think, well, for one, in the field of psychiatry, it seems like it is an area where there's just not enough people specializing in
Right.
substance use. But one thing I wanted to ask you about was to talk a little bit about that disparity. in kind of communities of color. And I'm glad that you mentioned the idea of the kind of the juvenile justice connection, because one of the things we talk about a lot on the show is how mental health plays into the connection with the juvenile justice system and how that disproportionately affects our youth of color as well.
Right.
So talk a little bit about why it's important in the Black community for us to be paying attention to substance use in our young people.
Yeah, so I know we're local and we're in Boston, but this plays out in every major and minor city across the country. So if we think about specifically for us in Boston, so youth use of substances is actually fairly equal across quote unquote racial demographics. So Black male who's 14, white female who's 14, Asian male who's 14, and others. They in essence, as when we look from a macro level, kind of all use substances around the same frequency, we'll call it. Now, the consequences of their use, there are drastic differences between white youth, Black youth, Asian youth. And so what will happen is, and what I've seen pretty regularly, so let's take an environment or a community like Newton. So Newton's a fairly well-to-do community within the greater Boston area. I might have a patient who is an adolescent, so 14, 15, 16, has been found by police in the local Newton, public park area, be it with a can of alcohol or marijuana. And a story that I've heard is, the law enforcement personnel will bring said kid, back home, to their parents, and they get a talking and say, hey, don't do this. And that's it. Like, hey, get help, and that help the parents find our clinic, and then they see me.
They bring them back home?
Yeah, yes. Yeah.
Wow.
So they bring them back home, and no one thinks the wiser. It's like, oh, well, this is what's supposed to happen. And in theory, it is kind of what's supposed to happen. You have someone who's 14, 15, who doesn't really understand what's going on, why they shouldn't be doing this. Yeah, you bring the kid back home to their parents, and the parents hopefully get them the help that they need. When I have Black patients who, and when I say Black here, it's like all encompassing. Black patients who, same scenario, but now instead of being in Newton, let's say that they're in Roxbury or they're in Mattapan, more, communities of greater diversity. It is rare that I hear that the officer brought them back home. How am I meeting those patients? Unfortunately, it's sometimes through our juvenile justice system, which is DYS here in Massachusetts. And so I've come to recognize that even though the substance use is used equally in different demographics, the consequences of substance use is greatly different. So that's from a law enforcement perspective. I could also talk about in schools, how do teachers and school systems treat students,
please do,
depending on how they look, and kind of mental health or substance use related behavior. So I have had, conferences with teachers at a, school district and system that has more predominantly white kids. And, I'm offering the same advice that I would for my Black patients, but the school is accommodating. They're saying, hey, let's just get you to the finish line. We'll reduce your coursework. We'll change structure. We'll get you into the special program where you have reduced classes. They're really trying earnestly to help and show the student, the parent, we will help you get to the finish line. The finish line is graduating high school. When I meet Black patients, oftentimes if there's some kind of substance use relationship that they have, it might be that they've been expelled from school number 1, expelled from school number 2. And so now when I'm talking to the school, I'm talking to the alternative school, i.e. the school that they go to if they haven't been successful in traditional schooling, which is odd to me because you're implying that it's on the student to be successful in the quote unquote traditional school, and not on the school system to create an environment where the kid can be successful.
Right. That's a
And
whole nother story.
yeah, and so I often see that play out just from an academic standpoint. Someone has what we would call behavioral dysregulation, so maybe they're irritable, frustrated. If they have different hues, their response by teachers is drastically different, and it bears out even in the literature. There was a recent paper out of JCAP, or Journal of Adolescent and Child Psychiatry, just this month that showed through the ABCD study that kids who are raised in single parent households and kids who are Black are more likely to experience disciplinary action, even when they're kind of like actually behaving just as regularly as other kids, just because of skin tone. So that's how it plays out from an academic standpoint. And again, I see this all the time. So very cognizant in trying to help change systems if I can.
Wow. So, for those of you that are just joining, you're listening to Black Mental Health Matters, and today I'm talking with Dr. Kevin Simon. Our focus today is on substance use in teenagers. So, if you guys have any questions, call us 617-238-7111, or you can go to our Facebook live feed on heat981fm.com and drop a comment online. So, what are some of the most common substances that that teens kind of get themselves into?
Yeah, so oftentimes people immediately jump to cannabis or marijuana, and certainly that is up there, but it ends up actually being the same traditional substances that people classically have heard about over their lifeline. So alcohol is actually most prevalent because it ends up being most accessible, be that in the house because parents have wine or dad has beer. There's always a liquor cabinet in the household. So alcohol actually tends to actually be the most prevalent substance that's used by adolescents, and the use actually ends up happening pretty early. And so even sometimes I used to be surprised. I might get someone who's in 8th grade who has had struggles with alcohol and using alcohol consistently. Ending up in the emergency room with alcoholic poisoning. So alcohol is there. Then we have tobacco, so tobacco or nicotine, particularly like vaping devices. We see less often traditional cigarette use, but vaping certainly up there. Cannabis is high on the list, and then I given the clinic that I'm in and the focus of the clinic is substance use. I do see folks who have opioid use disorder. And a host of other substances, so hallucinogens like LSD, stimulants, not just the prescription kind like Adderall or Ritalin, but cocaine, and a host of other things, inhalants. I end up asking a lot of teens about all substances that they may have used. And so it's not surprising to get someone who's even tried something like peyote or mushrooms.
I wonder if that's not as common in our geography, or I guess our geographical
Yeah,
region.
so yeah, it's not particularly common, but however, with the internet, like nothing's actually far away.
Yeah.
And so like I've had cases where 14, 15 years old, and parents were putting in strict restrictions around the household, monitoring, and months and months and months has gone by without any substance use, and parents said, hey, you know what, we're going to go on a date night, and you're going to stay home, and with cell phone and social media,
Wow.
substance was delivered to the window, right? like of the kids' room.
Creativity.
So, yeah, they're really accessible, and it's not like that I guess depends on who's watching or listening. It's not like the 90s where you have to actually walk outside. Like things will come. I've had parents turn off their mail system because things were coming in through the mail, postal. So substances, they can, if they if somebody wants to get them, they undoubtedly will get them.
So, I wonder for like the parents that might be listening. So I know there's a lot of folks listening. They might have young people, and they might think, that's not my child. Like
Yeah,
my
yeah.
child doesn't use drugs. Can you just speak a little bit about maybe like how do our young people even get introduced to drugs, like kind of the various different ways, and maybe a
Right.
little bit about like some of the signs that something is up. May or may
Yeah.
not be substances, but something's up, that kind of
Right,
thing.
right, right. So I like to tell parents it's multifactorial, i.e., there's a lot of different factors that play into somebody engaging in substance use and then it becoming problematic. And so there's rarely a silver bullet or that one thing that can indicate. But I would say, one. So if we think of like the biopsychosocial model, right? So biology. So what's the family that you're coming from? What's the genes and the genetics that have been passed to you? Undoubtedly, oftentimes there's a family history of substance use. So grandma, grandpa, aunt, uncle, somewhere in a lineage, there's someone that's probably struggled with it, and there's more and more evidence showing that there are genetic links to substance use. So genes is one part, and then oftentimes what will happen, and I'm sure you can attest to this, I'll meet people who have adopted or foster a child, and then they're wondering, they've been with me since, they were, out of the womb. And we got them right from the hospital. How come this is happening? I said, well, that may be true that in your household and in your environment, there is no substances and you're doing all the things that you can. However, we have no clue sometimes who and where they came from, right? So what was the intrauterine environment of the mother to the child? Was there any substance use engagement on mom or father's part? So a lot of times genetics is a component. Then the next thing is the environment, right? So if you have somebody that has like genes that are susceptible to substance use disorder, but then they're in an environment where they don't really have access to it, their friend network that don't engage in it, that person may very well never develop a substance use disorder. But a lot of times you might be in an environment where things are offered to you, you are at that party and someone says, hey, do you want to try this? And that try becomes something that kind of, without for better or let's say, turns on that factor that says, oh, hey, let's try this again. And then that second try turns into a third, turns into, I thought I was only going to do this one time, and now I have a really hard time stopping. And then, so that's the environment. And then lastly, sometimes I'll just say like the personality of the person. So, I think a lot of people who listen will undoubtedly be able to tell you there are some kids who hear what parents say and like say, mom said don't touch the stove, it's hot, so I'm not touching the stove. And they might look at their brother like, why are you going to touch the stove? Mom told us it's hot. Yet there are some siblings who say, I got to touch it for myself. I don't know if mom and dad are telling me the truth. And so that same thing happens with regards to substances. I think some kids, yeah, they do buy in early that, oh, this can be problematic, and they can look and they're observant and insightful. And then some other kids say, I don't think that's going to be my issue, and they fall into it. Be it friend offered it, they got it from social media, and it turns into something that they really then have a struggle with, and really are hardwired with regards to how we break that cycle.
Oh, wow. So it's kind of a lot of different things that can contribute. I mean, do you find sometimes that parents blame themselves a lot, or kind of feel guilty that they didn't do enough? And what would you say to that?
Yeah, I think I see both ends. So I even people who are bringing their kids to the clinic, and we have a pretty thorough evaluation, when we then share what our findings are and what the diagnosis might be. But so you might say, oh, your daughter has mild cannabis use disorder, and they're like, what? No, oh, we thought that this was just like one time use. And it's like, well, actually no, it's actually been going on for a year, and her grades are dipping, and you're talking about she's more irritable, right? And so I'm listing all the factors that play into why we're saying it's an actual disorder and why it's at the mild severity. And there might be a significant disbelief of like, we did not anticipate that was going to happen. And I think that's a shock that a lot of parents have. And then in terms of the specific question of, do they blame themselves? I think sometimes I do get parents who think to themselves, if they were more strict, or if they if they were communicated better with their child, that somehow that could have deterred. And again, because oftentimes I can't pinpoint one specific thing, I've never actually heard of or had a case where it was because of one argument, or because of one detention, or because of one grounding, I should say, that that turned into a substance use disorder. So I tell parents, they can certainly, there are factors that they can change about them, or modified factors that they can do, right? So like, how do you communicate about substances? How do you communicate about finances? What are expectations about your household? And, how are you setting up limits, so that way, if something does happen, that we know that there should be a hard stop. So there are things that parents can do to, mitigate use, but oftentimes it's not just because the parent was quote unquote a bad parent that their child engaged in substances.
Yeah. Wow. So for those that are joining or listening to Black Mental Health Matters, if you want to drop a comment, go to our Facebook page, heat981fm.com. You can also go to my Facebook page, drkerryann, and see the live feed, drop a comment, ask a question, or give us a call at 617-238-7111. I'm here talking with Dr. Kevin Simon, who specializes in addiction medicine and child psychiatry. So I wanted to kind of ask a little bit about substance use in teenagers in the sense of how it affects their brains, because I know sometimes there's these kind of two schools of thought that, young people are just resilient, so they'll just bounce back. And then there's the other thought of, well, maybe they're kind of young. I wonder if it's going to cause some permanent damage. Tell me how substances, for example, like alcohol or something, like how does that affect the teenage brain? How should we think about it?
Yeah. So simple explanation, hopefully that even for those that are listening, they can visualize this. So the adolescent brain obviously is still developing, and there's evidence suggesting it kind of doesn't fully stop to like maybe even 24, 25. It used to be thought like, 17, 18, they're done. So the fact that they're still developing, happening, anytime that you're engaging in substance use, you can alter how that development happens. Now, of all the parts of the brain that are important, one of the most important is the prefrontal cortex. And so for anybody who has a hand and can cup their hand and put it over their forehead, that's where your prefrontal cortex is. And what's the prefrontal cortex? That's executive functioning, executive planning. So the reason that Dr. Carryann and I know, oh, wait a minute, it's the first of the month, I got to pay my bills. I have to go to this place and pick up groceries. Oh, it's Sunday at 1:00, we have this interview. All those planning things are in the prefrontal cortex. So you can imagine as an adolescent, that's actively developing. Well, what are the things that are important for adolescents in terms of their prefrontal cortex? Well, classically, you're in school, right? So are you turning in your assignments on time? Oh, you got practice. Did you do your homework before your practice? Oh, wait a minute, I also have a summer job. Am I going there on time? When you engage in substances, or at least what I've seen and what the literature shows, when adolescents engage in substances, what you find is that their planning becomes offset. And so they are much more likely to engage in risky behavior, which they already do at a higher clip than adults, but they're even more likely to engage in risky behavior. So what you find is kids who use substances, greater likelihood of accidents, even motor vehicle accidents, greater likelihood of engaging in self-injurious behavior. So we can think about, cutting, or suicidality or suicide ideation. Kids that engage substances are more likely to experience that. In terms of mood regulation, kids with substance use disorders and substance use are more likely to have affective disorders, so anxiety, depression. So, there's actually a laundry list of things that can, worsen with substance use. And I see it, pretty regularly. Again, the 16-year-old or 17-year-old just got a license or driver's permit, got into 2 accidents. It's like, wait a minute, 2 accidents in this short time span. Yes, you're a new driver, but was there any engagement in anything? And what's evidence show, when you engage in cannabis use, your perception and depth perception is off, your reaction time is off, all things you need for driving. And again, school performance tends to classically, if you got a BC student, if they engage in substances very early on, that BC stable student becomes the DCDF student. The A student goes down. So there's a lot of things that substances can negatively impact with regards to adolescence.
So some of the things we're looking for, and I'm thinking about like signs. So one of the signs also is the declining grades. Like suddenly you're a child who had a certain kind of academic performance is starting to slip. Something is wrong. That kind of
Right.
thing.
Yeah. So it's again because it's multifactorial. So a lot of adolescents, let's speak to teenagers specifically. A lot of teenagers obviously are trying to just identify who am I in this family. I have my own particular interests, and that may very well be true. So for myself, when I was 16, 17, 15, I loved playing basketball. I literally have a basketball kind of all the time with me, and so if there was a family event or basketball practice, I'd much rather go to basketball practice, right? But that's a quote unquote healthy alternative to engaging in the family event. When you start to see kids have interests where they don't want to be with their family, not just because they have another interest, but seemingly they just want to be home, or they're despondent, they're losing their friends. Those are subtle signs of something's off, or maybe even more irritability, more frustration. Certainly, females have menstrual cycle, males have increases in testosterone. Yes, there can be some fluctuations in mood, but it shouldn't be so drastic where now you recognize that any quote unquote little thing becomes like, a firecracker, or you got to feel like as a parent, I'm walking on eggshells because I'm not sure exactly what part of my conversation or what question I ask is going to offset my kid. When that happens, you got to think, okay, I know that they're becoming a teen, but it's not usual to argue every day. It's not usual to be frustrated every day. It's not usual to be upset every day. So when those things start to happen, you got to ask yourself, did the household change? Is it school? Did you not make the team? Or, oh wait, is there something else that's been introduced that when that substance is leaving, you are more likely to, yes, be irritable. So I've had the classic example, 15-year-old single mom. This has been on the white and black side, single mom, and finding that the son's a little bit more irritable. And come to find out, the son was engaging in vaping pretty regularly throughout the day. And so what is it when you have nicotine in your system? Yes, there's a quick momentary concentration boost, but when nicotine leaves your system, you find that you're more irritable. And this is why people classically were chain smokers, right? Because it's very hard to break needing the nicotine. And so kids that are vaping, I find that a lot of them, they have real difficulty when their parents start to ask them, like, what's going on? And their response is just so much more heightened than what it would otherwise be for them. So there are a lot of subtle changes that I think parents recognize, but oftentimes we attribute them to the normalcy of teenagerhood. And then again, it's not until maybe a year later where now when someone like Dr. Simon's asking them questions like, oh, you know what? Actually, yeah, I remember last summer this was changing. Oh yeah, I do remember the grades kind of went down. We just thought that the work was getting harder. So there are a lot of subtle things, and unfortunately, you need time for those subtleties to accumulate, and then someone with a trained eye to say, wait a minute, let's actually start testing some things out, because this is seemingly unusual for generally healthy adolescents.
Yeah, and that makes sense. Is that if you start seeing that something isn't right, to kind of look into it, because it may be substances, it may be something else, but it may be that you still have to kind of pay attention to it. But I can imagine that if it's happening as a slow fade, that parents might attribute it to other things, and then all of a sudden it just everything comes together, and you're like, "What? You're
Yeah,
using this?"
and this is where collaborating with our pediatric colleagues comes in handy. And so oftentimes I'm sharing or teaching to pediatricians about how they should be routinely screening for substance use, and the perfect scenario is right before school. Kids have to get their annual checkup for school. You have mom or dad removed from the room. You tell the kid, the information that you tell me is confidential, because there are actual federal policies regarding confidentiality with regards to substance use and or sexual health. And you tell the kid, you can tell me anything. I do not immediately go and tell your parent, but I need to understand if there's any kind of risky behavior. So alcohol, tobacco, cannabis, and you just go down the list and see if the kid says that there's any use. And now if there is, because there's really some very nice screening tools. One is called the S2BI that pediatricians can go to online and click a couple of answers and get a little rating of, is this a mild, is this moderate risk, is this high risk? And if you see that there's a moderate or high risk, then you need to think for yourself as a clinician, okay, what are resources that I might need to refer this particular child to, or how do now I potentially frame this for the parent where they understand, hey, your child actually recognizes that they're engaging in some use and they'd like help with it. They were maybe a little bit, weary or fearful of telling you, but they told me. So let's commend them that they told me, okay, hey, here's now options A, B, C with regards to how to get this handled.
Oh, wow. And as you mentioned, the communication and kind of how to help parents talk to their kids about substance use without, because the reaction that I imagine that kids fear, so I can't tell my mom or my dad or my parent that I'm using substances because they're gonna be mad at me. They're gonna get angry.
Yeah. So that's a great point. So I get a lot of teens who, even pre pandemic, when people were coming into the office, and I'm going through my questions, and I hear about what I view as concerning substance use, and I say, okay, how are we gonna tell mom? And like, tell mom? I'm like, well, you're 14, so there really shouldn't be any use, and you're telling me about both cannabis and alcohol use, and it's happened more than once. So yeah, we gotta tell mom. And I have that conversation with them and say, okay, would you like me to let her know? And when the mom comes in, again, I just like I framed it before, I'm explaining how the maturity that the child is showing by being honest to the healthcare provider. Let's take this time right now to think about how do we move forward, because taking this time right now to think about how we punish the child is doesn't serve any purpose. And we can't think about all the things that we didn't do, because it doesn't serve any purpose. But let's think about how do we move forward, and how are we going to help protect the child and protect their mental health. So I think the way that I end up sharing information with parents, and the way I kind of break it down for I want to say students, for patients, I have not had a scenario where the parent did not know, came to know, and then it's a major argument in the office, and even now virtually, like, that tends not to be the case, because again, I think framing it for the parent that they're here for help. I'm here to help you. That then turns into, okay, how do we move forward? And there are going to be challenges. I'm not saying that there won't be, but just being upset and further grounding them. Do house rules need to change? Potentially. Does access to finances need to change? Yes. Does liberty to drive need to change? Yes. But those are all things that can be like appropriately, strategically talked about as a family, with your provider, so that way moving forward, if slips or relapses happen, because that tends to be common, we know how to address it rather than just being, 100% punitive.
Oh, so it seems as though one of the benefits of talking to a professional, one of it is actually for parents is some parent coaching, kind of a sense of like, how do I even talk to my child about this, because they might be having their own emotions about like, I'm surprised to hear that my child is using substances. So they may have their own responses, but getting that coaching, kind of saying, here's
Yeah,
how to
yeah,
think about it.
exactly. So, with regards to parent coaching, there's several C's that I think about. So again, cash, car, um, uh, curfew. So there are some things that I will remind parents about in terms of, cell phone. When we're thinking about something bad happened, or you perceive something bad to have happened, okay, which one of these C's can we kind of change? Which one of these C's can we alter? So for instance, if it has been the case, if there's a 17-year-old and there's been, a lot of use of alcohol, and we say, okay, well, you can't use mom or dad's car anymore, or the guardian's car anymore, until there's, several months of abstinence. Then that becomes the driving, motivating factor of, okay, well, I got a girlfriend and I want to go to the movies, and I have a job. Okay, well, these are the kind of consequences that can happen when you're engaging in use that you shouldn't be. So again, you're trying to help the child understand what they're doing has consequences outside of even just themselves, right? So again, you have a boyfriend, well, you're going to see that person less because of the substances that you're engaging in. Oh, you had a job. Okay, well, now you don't have a job, so you have less finances. So, this is what happens classically for adults, right? We get to a certain age and we know, oh, wait a minute. And I tell kids this all the time. I said, if I'm on the job and this is water, but with alcohol, yes, it's legal for me to drink alcohol, but is it appropriate for me to drink
Right.
alcohol on the job while I'm talking to you? No, that's inappropriate. So even when you become an adult, will it be appropriate for you to drink alcohol or to have cannabis, and then that's in your system, and then you're at the hospital if you're in the hospital system, or any work environment? If you were randomly tested, which in some fields that randomly happens, you can see that there's huge consequences, right? So even in the Olympics, we recognize that there's consequences related to use. Are those consequences correct? That's a bigger question. But when there's some set of rules that exist, you got to understand, okay, well, how do I best for myself exist in these rules that exist while also trying to change them potentially? So I think that's what I'm trying to get at for patients and for families.
So things that I wanted to ask you about is this, and because I run into this all the time with teenagers. The listeners know that I specialize in working with kids as well, and there's always this perception of certain substances are safer than other
Right, right,
substances,
right, right,
so there's this perception of like vaping and cannabis as like the safer things, and I'll talk to kids and they're like, oh, I don't really. I drank a little bit, but I don't really drink. I
right.
mostly smoke weed, and I don't see myself stopping weed. Or they'll vape, and they're like, well, it's just this or that. Like, as someone who specializes in addictions medicine, what are your thoughts around this idea of safer substances? And Are they actually safer? What are your thoughts?
Yeah, so this is a great question, and yes, comes up all the time because people will say, oh, or well, it's legal. My some will say my parents do it, and it's like, okay. So from a tactical standpoint, with regards to legality, yes, it's legal, but not for your age, right? So I will just overtly say that. And then this goes back to, well, one of the reasons I came into child and adolescent psychiatry is when I meet Black and brown patients, I'm like, if you're caught with it, your consequences are drastically different than if somebody else is caught with it. So that has to be at the forefront of your mind of, I can't do this because what ends up happening to people that look like me, I don't want to be in that situation. So from a legal standpoint, that's one avenue. In terms of the actual safe versus not safe, I have seen in the hospital on inpatient units multiple patients who have only used cannabis and had negative consequences as a relationship of the cannabis. And so there's cannabis-induced psychosis that I have seen. There's unfortunately now, which has become more prevalent, adulterants in the cannabis. So, a lot of times things that are being prepared next and around other substances. And so I've had patients who thought they were only using cannabis, and then come to find out via drug tests that there's fentanyl in their cannabis, or methamphetamine in their cannabis, or something else that they did not anticipate to be in their cannabis. And so again, because when you're a teen, you're generally not getting cannabis from like a cannabis dispensary, but from somebody on the street, because it's not legal. Back to that legal for you to go into the cannabis dispensary. You actually a lot of times don't even know, well, where's the source of this cannabis. And so a lot of times what I have done for the patients that I see who might be, as you mentioned, like very low in motivation to actually stop, I then have to use like a harm reduction model. Okay, well, I get your like 1 out of 10 on wanting to stop. However, can you go to somebody different than the person you've been going to? Because 2 times now we've had positive tests that showed cannabis, but then also showed something else that you didn't think you were taking. And there have been times where patients undoubtedly find a different source and it's only cannabis in their system. Am I trying to get them to decrease their cannabis use? Yes. But I also recognize when we're talking about cannabis or potentially opioids together, well, I have to even further decrease and minimize the risk of the opioid, which has a higher mortality, that I have to infuse a harm reduction model. So, cannabis-induced psychosis is a real thing. Substance-induced mood disorders are a real thing. So I've had patients who cannabis and other substances use it and get panic attack, use it and become manic, use it and experience emotions that they had not otherwise experienced, use it and become paranoid, use it and stop working in the job that they've been working in because they can't function the way that they're supposed to. And what I tend to tell youth and parents is, I think of cannabis, and particularly high potency cannabis, it can be like a wedge to a door that opens up. And sometimes when you open that door, you're letting in things like psychosis, or you're letting in things like paranoia. And sometimes we can close that door just by minimizing use and stopping use. Sometimes that door becomes open and hard to close. And then I got to introduce other medications like antipsychotics to help you be less paranoid, to help you not experience auditory or visual hallucinations. Most people don't want to take Risperdal, Abilify, Seroquel, I can name names. But if the use became so problematic that you landed on an inpatient hospital and now you're discharged and you trying to find somebody that can treat you, a lot of people honestly in our field will say, whoa, wait a minute, I don't really do the substance use stuff. If you just have ADHD, hey, I got you. You got depression, I got you. So then families find themselves really stuck because like we don't know where to go, and our kid really has a problem. It's like, yes, these are potential consequences of substances long term. Do most kids think of that? No. But that's why it's important for parents and for professionals to be well informed, so that way they can try to help guide, kids in the right direction.
Yeah, and I can attest to, I've had so many cases of kids who have become totally psychotic after smoking weed. And so
Yeah.
there's kind of, again, this perception that, oh, well, there's a certain number of kids that seem okay, but it's like this kind of, do you want to take the chance? You want to take the
Yeah.
chance that you could be this person, again, if it's adulterated, something else is added to it, you don't know, or even just cannabis itself can
Right.
induce psychosis, and a lot of people don't realize that.
Yeah, the evidence says, the more time that we can delay, like the first initiation of any substance, the better and less risk you have as an adult to actually developing a substance use disorder. So the evidence is 95% of adults, so folks who are older than 21, who have a substance use disorder, 95% of persons who are adults have substance use disorder, started to use substances before 18. Really problematic period is if you're using substances before 16, then you just like doubling, tripling your risk of developing a substance use disorder. So, I really, in terms of my like primary prevention, when I'm talking to schools or talking to pediatricians, I'm saying like we're trying to just delay the use as much as possible, because when it happens early, it can really become hard to treat and hard to handle for a whole host of reasons. You got to use certain medications. Now, privacy becomes an issue. Do you tell the school? Do you not tell the school? Parents are like, hey, do I tell the camp? Do I not tell the camp? I'm like, these are all great questions, and we have to think about strategically. Okay, how does Dr. Simon write a note to the school to say, oh, Jane is missing because she's engaged in treatment? It just has to be very, very, bland. And that puts a family in a position where they're not really certain, can I tell someone? Can I not tell someone? I've had parents, tell me that they're scared to bring their kids to an emergency room, right? In the risk of an actual emergency happening, scared to bring their child to the emergency room because they're fearful that for us, the Division of Child and Family Services is going to come in and then say, oh, well, how come this is happening under your roof? Oh, and they're really concerned that somehow the child's going to be taken out of their home. Are there consequences like that are happening? There are, right? If we think about really young and we think about pregnant women, classically what happens if there's any use of substances, social work is deemed responsible for informing, state services. I tend to tell parents, when you're not a pregnant female with an infant, but you're an adult with an adolescent, you're not expected to make sure that nothing ever happens in the household, because the reality is a substance can happen. They could have a boyfriend over. Like a lot of things can happen even when you're being an appropriate good parent. So just because you bring your kid in for concern doesn't inherently mean that DCF is going to come in and say, oh, you're a bad parent, X marks the spot, and they remove your child. But again, these are things that are Black families particularly are thinking about, and can be, negatively contributing to why someone doesn't get help, right? Because who do I tell? How do I tell? People already think of me and think of our family a certain way. So a lot of stigma around substances and mental health services. So, these are things that I'm trying to inform families and be an advocate for them. Say, patients I see, like, come in. I will even call the ED and let them know that this is the scenario. You're not by yourself in this. And a lot of families do feel like they're by themselves.
Wow. So, I mean, as we kind of come to a close, I wonder about the hope for families, and, that things can get better if they do have a child that has become involved in substance use. If there's someone out there maybe who they have been a bit nervous about letting people know because they're just worried about how the family's going to be perceived or that sort of thing. I mean, where should they start? I mean, should they start with their pediatrician?
Yeah. So if there's any if a parent has a true concern that their kid's engaging in cannabis, alcohol, tobacco, nicotine, vaping, anything, first line of order, yes, you inform the pediatrician, because the pediatrician may very well be connected with a system where they can get access to a consultation or can get access to services. So I think informing the pediatrician is appropriate. If you're in the greater Boston area, there are 3 academic affiliated institutions that have adolescent specific treatment programs or outpatient programs. And that's at Boston Children's Hospital where I work, that's at Mass General Hospital, and that's at Boston Medical Center. And I know that there are other institutions, Newton Wesley Hospital, Brigham and Women's Hospital, that are developing programs and might very well actually have the programs at this time. I don't work for those institutions, so I can't speak to them specifically, but there are programs that exist. And then I know for sure that there are also community-based programs that exist. And so, parents shouldn't fear that they're unable to get the assistance and get the help. Might there be a wait list or a wait time? Yes, particularly if you're seeking just specifically child psychiatry. But there are a lot of other iterations of care that can happen even while someone is waiting. So a parent should not just feel like they have to carry this burden by themselves. And so there are avenues to actually get care.
Well, Dr. Simon, thank you so much for coming on the show today. I think that I think this is a very important topic, and I think we'll have to kind of revisit it over and over because the young people in our communities are just so vulnerable. As you mentioned, there's so many ways for them to get introduced to substances, and with today's world, there's a lot of ways for them to access it. I mean, deliveries right to their window, very quickly. And I mean, I think I even saw something where they could give the person delivery instructions to like hide packages behind bushes and things like that. So there's just so many ways for our kids to get substances.
Yeah, no, I appreciate the fact that this show is catered and targeted towards Black families and communities, and any opportunity that I have to share information, gladly appreciate it. And for kids of color, and all kids, engaging in substance use can really deter them and negatively impact them. But I have also seen Black and brown and across the color spectrum kids get the adequate services, get the adequate treatment, and continue to actually flourish, right? So they have graduated from high school, they are getting accepted and matriculating into college, they are getting a job, they are having better relationships with their family. So that's definitely a possibility for people. And so it's not just like this hopeless story. It's also, again, it's one of the reasons I came to Child is like, how can we help change trajectory for things that are going on potentially a wayward path? And I have definitely seen positive changes in patients and families together.
So things can change.
Yes, definitely.
So, Dr. Simon, is if people wanted to, follow you on social media and kind of keep track of what you're up to, how can they find you?
Yeah. So I have an Instagram and Twitter account, which is the same @ DRKMSIMON. So Dr. KM Simon. And I'm, pretty regularly posting or writing, so people can engage with me via those 2 platforms.
Awesome. So, guys, if you have any other questions, you can contact me throughout the week at drkerryann on my Instagram. You can go to my website, drkerryann.net, and tune in again next week, Sunday at 1 p.m. Eastern Standard Time, for Black Mental Health Matters. So have a great week.
Hey everyone, I hope you enjoyed the show today. For more on Black mental health, you can go to my website, drkerryann.net. You can also follow me on Instagram, also at drkerryann, and tune into my show every Sunday at 1 p.m. Eastern Standard Time on heat981fm.com. Take care.